the most overlooked signs of a mini-stroke. And because the symptom often disappears as quickly as it comes on, it's easy to ignore. But your eyes are an extension of your brain. And when something changes in how you see the world, it could be a warning that your brain isn't getting the blood it needs. Many strokes or transient ischemic attacks can affect different parts of the brain, including the areas that manage visual processing. That's why vision problems sometimes appear with no warning at all. You might suddenly see shadows where there are none, feel like a curtain has been pulled over one eye, or find it hard to focus on familiar objects. These changes don't always come with pain or discomfort, which makes them harder to take seriously in the moment. But whether it's both eyes or just one, a sudden shift in how you see deserves your full attention. Take for instance a man named Walter who was 75 and still enjoyed his morning walks around the neighborhood. One morning, he noticed that everything on the left side of his vision was blurry, almost like he was looking through frosted glass. It lasted just a few minutes, and by the time he got back home, his vision was clear again. He almost didn't tell anyone, but thankfully his wife insisted he call the doctor. Tests later confirmed that Walter had experienced a mini-stroke. Because he got help in time, doctors were able to adjust his medication and reduce the risk of a full-blown stroke in the future. What makes this sign so dangerous is how easy it is to dismiss. We're used to eye floaters, dry eyes, and the occasional blurry moment as we age. But a sudden unexplained visual disturbance, especially if it lasts more than a few seconds, is something you should never ignore. Your vision is one of the most sensitive indicators of your brain's health. And when it changes quickly, it may be your brain's way of asking for help. In so many cases, people regret ignoring that weird little episode with their eyesight until a bigger event comes along. But the good news is that you don't have to wait for a major stroke to take action. Your body often gives you clues. You just have to know how to listen. And when it comes to your vision, even a small change can carry a big message. Sign 4, sudden numbness or weakness on one side of the body. One of the clearest and most common signs of a mini-stroke is sudden numbness or weakness that affects one side of the body. It may come on quickly and disappear within minutes, which is exactly why so many people ignore it. You might feel your left arm go limp or notice that your right leg isn't quite responding the way it should. It could even be something as subtle as your fingers feeling like they're asleep or your facial muscles twitching or sagging for no clear reason. These aren't just random quirks of aging. They are serious warnings that something is happening inside your brain and it demands attention. When a mini-stroke occurs, it's typically caused by a temporary blockage in blood flow to the brain. And depending on where that blockage hits, you may lose function in very specific areas of your body. That's why the symptoms often appear on only one side. The brain's control over our limbs is split. The left brain controls the right side of the body, and the right brain controls the left. So if one side suddenly stops working properly, your brain is waving a red flag, telling you that something is interfering with its ability to communicate with the rest of your body. The scary part is how easily we talk ourselves out of concern. A man might wake up in the morning, feel his arm go numb, shake it a bit, and blame it on the way he slept. Or maybe he feels his leg give out for a moment while standing at the kitchen counter, chalking it up to fatigue or dehydration. These explanations may sound reasonable in the moment, but they can be dangerously misleading. The truth is, numbness or weakness that shows up suddenly and affects one side of your body is not normal, no matter your age. And it's not something to wait and see about. Whether it lasts 30 seconds or 10 minutes, it's your body's way of sounding the alarm. Ignoring that alarm could mean missing the window to prevent a major stroke that might leave permanent damage or worse. Think about this. If you saw your neighbor's smoke detector go off, even for just a few seconds, would you shrug and say, "Oh, probably nothing"? No. You'd check for signs of fire, call for help if needed, and make sure everyone was safe. Your brain deserves that same kind of immediate care and caution. Numbness or weakness on one side of your body is your brain's smoke alarm. You don't have to panic, but you do have to act. Many seniors hesitate to speak up about these episodes, fearing they'll be seen as overreacting or bothersome. But there is nothing inconvenient about protecting your brain. In fact, the people around you, your children, your friends, and even your doctors would rather you mention something that turns out to be nothing than say nothing at all and risk everything. Take for example Harold, a 72-year-old retired electrician who one morning noticed his right hand felt strangely weak. He dropped his coffee mug, brushed it off, and went about his day. The next morning, it happened again, only this time, he also noticed a slight sag on the right side of his mouth in the mirror. That got his attention. He went to the doctor that afternoon, and sure enough, tests showed he had experienced a mini-stroke. His quick response meant doctors could treat the underlying issue, adjust his medications, and reduce his risk of a future stroke dramatically. The takeaway here is simple. When your body suddenly stops responding the way it normally does, especially on one side, it's time to stop, pay attention, and take action. Don't wait to see if it passes. Don't downplay it. Call your doctor or seek medical attention immediately. Your future self will thank you. Sign 5, sudden severe headache without a known cause. One of the most startling and easily dismissed warning signs of a mini-stroke is the sudden onset of a severe headache, especially when there's no clear reason for it. This isn't your everyday tension headache or the kind you get when you haven't had enough water. This type of pain often feels sharp, intense, and unfamiliar. Something that grabs your attention right away. It might come on fast and disappear just as quickly, but that doesn't mean it's harmless. In many cases, it's a signal that something has gone wrong with the blood vessels in your brain. You see, headaches can be tricky. Most of us have had them at some point in our lives, and as we get older, we sometimes accept them as part of the aging process. But a mini-stroke can trigger a very specific type of headache, one that feels sudden and strange. Sometimes described as a thunderclap headache because of how quickly and powerfully it appears. It might feel like it's centered on one side of your head. Or you may feel pressure behind your eyes or across your forehead that doesn't resemble anything you've experienced before. What makes this sign dangerous is how often it's brushed aside. People say it's probably just sinus pressure, or maybe I didn't sleep well last night. And yes, those things can cause discomfort. But if you suddenly feel a sharp, intense headache that seems to come out of nowhere, especially if it's accompanied by other